Hi, my name is Jaden Salazar, and I am currently a second year student at the UNLV Occupational Therapy Doctorate Program. I wanted to talk about my fieldwork experiences in my first blog, and especially what my stressors are during fieldwork, and also how to manage manage my stressors in fieldwork. So, first question is, what identified fieldwork stressor do I feel is currently causing me the most stress? So for me, I am currently in St. Rose St. Martin acute care, and it is a hospital setting. And we all know, hospitals are very, very unpredictable. So the number one stressor during my fieldwork has to be my fear of the unknown. I know that this is an environment that has to promote learning and has to promote growth. However, to put it in simple terms, stuff happens all the time. Stuff happens. So, my biggest thing is that I have to learn how to be adaptable during these situations. And although that it is causing me a lot of stress, panic plus events is probably a recipe for a disaster. So that brings me to my next point. And what is one stressor that is not going to be in my control during field work? So that is to point out the obvious. The events that happen are going to be stuff that's not very much in my control. As I mentioned before, the events in the hospital are very unpredictable. I can't control what happens next, nor can I predict what happens after. So I have to learn how to be adaptable during these stressful situations and how to plan accordingly. So how to manage my time and what can I do to figure out a solution to these events. So brings me to my next point. What is one fieldwork stressor that is going to be in my control? So, even though I can't control the events that happen in my fieldwork, the only thing that I can control is how I react to these events. Yep, stuff happens all the time, but what I can control is how I react to it. How do I approach this? Am I able to keep myself calm? What in the environment is something I can do to change to help alleviate the situation? What can I do to make sure that I am keeping myself safe? And what am I going to do to keep my patient safe? I am able to control how I react to these certain events, and then I can control how I feel at that very moment. So, like I mentioned before, stuff happens, but while stuff happens, there is always going to be a solution to a problem. And my job as a student is to learn how to adapt from these situations. My fieldwork educator has been showing me tips on how I can adapt, how I can create a plan B, I can create a plan C, and always plan ahead because you will never know what happens uh, in this hospital setting because it is very unpredictable. So, what that brings me to my last point is what is one stress management strategy that I found has helped me through my fieldwork? And I think that the best stress management strategy that I found is to just breathe, smell the roses, blow out the candles. Because how am I going to be in service of my patients if I myself don't know how to control my emotions? Panic is probably the last thing any patient wants to see when it comes to their provider, and I have to keep myself composed in order to bring myself to become adaptable. I believe that controlling my breathing is the most basic yet most vital thing I can do during these stressful situations. If I keep myself calm, I can keep my panic to a minimum and I can go ahead and have clear my head and to think about what I can do next, what I can do to correct something if I make a mistake, what I can do to plan accordingly, and what I can do to plan ahead to ensure the safety of myself and to ensure the safety of my patient because they deserve the best care possible from me. So that is my biggest thing for alleviating stress during this very unpredictable setting and how to better become more adaptable during my time in field work. So thank you and have a good night.